So I'm just going to talk about the project that I'm doing for my level 5 leadership and management in health and social care. The project is obviously recruiting an information advice and guidance coordinator. The role will be helping deaf, blind and hard of hearing residents in the RCT area as a pilot. We're hoping that if it's successful we can roll it out to other local authorities. So the job role will entail obviously shadowing Catherine and Sharon to introduce us into different communities, hard of hearing groups. We thought about the advertising the role, so in GP surgeries, dentists, work with RCT sensory team, obviously make a drop-in session in the Deaf Club in Pontypridd. I'm hoping to devise a poster to advertise with Luke and Lucy, obviously one poster for professionals so we can put it in GP surgeries and various other places, and one in BSL and put it on the website. Also, this person's going to link in with British Deaf Association, Sense, Deaf Blind UK, and obviously CAUSE, and all the hard hearing groups that are in the RCT area. Build up neighbourhood networking within RCT, like with Interlink, etc. Also going to look at maybe providing some awareness training for employers, education, just to increase that awareness, and if anybody comes to us with an issue we can offer that as a part of the service. Going to make sure that all the project materials are going to be accessible in different formats like BSL, any online platforms. Going to also give out information in regards to Sign Live, Sign Wow, interpreting service, so hopefully that will bring business to the agency. Obviously going to keep up all records and also get feedback from the service users. Sorry, my writing's I just wrote quickly. So it's going to be improved access for information for it to be accessible by anybody in the deaf community, hard of hearing or deaf blind. Going to increase the engagement and hopefully the satisfaction delivering the service. Going to involve more people and take on their views and opinions, so obviously to improve services. Obviously we're going to hopefully follow in line with accessible technology, video relays, Sign Live as I mentioned earlier, make sure hearing loops are going to be in the drop-in sessions that we're going to run. Obviously we've got to meet with legal and policy obligations on accessibility and make sure that the project will be in line with that. Obviously we've got to gather evidence for the Wellbeing of Future Generations Wales Act, and the main outcome really is to reduce all the accessible barriers and communication barriers that people do face on a daily basis. So the position's going to be 14 hours a week. We're looking to have something on the website that somebody can video themselves in BSL, and then I can look at that and then sort of prioritise if it's urgent and what help they would need. We're going to run in drop-in centres, one with the local library, maybe once a month, obviously the deaf clubs, and obviously hard of hearing groups, as well as hoping to have a set amount of hours on a particular day a week so that we can advertise. So say like we know they can be here on a Thursday morning, so that people are not turning up ad hoc at the door and we're all on panic stations, because obviously it's taking time for your own roles. and stopping people sort of, you know, coming in and, you know, obviously we've got a gentleman up there that's arrived early and waiting for somebody to help. So yeah, it hopefully will bring more business to the agency, and it you know, increase that access and break down them barriers that people in our community or RCT community face. Obviously, all the recording, record keeping will be in accordance with the GDPR legislation, and any feedback would have gained consent from service users. Are there any questions? And also risk assessments that would need to be carried out. For example, you know, lone working, etc. Are there any questions?
No.
No?
No question. It sounds like a perfect fit for you.
Yes.
Absolutely. Actually, just a question. What about hospitals, audiology, ear, nose, throat, ENT? I mean, yeah, the Hard of Hearing Club, I'm sure a lot of people would be registered with them, and also schools. That might be something as well. And I know that Catherine's been to some, maybe could give out some information. So that's a couple of places where you could advertise.
Yeah, that's
There'd be a high number of people who need that service who would be accessing.
That's a good idea. Thank you, Charles and Catherine. You know, hopefully we may even be able to set up something online that if people turn up in audiology or got any problems, you know, it's all about the co-working and partnership, isn't it?
And training for safeguarding.
Yeah, we need to put whoever's in the role will have to obviously be trained up in regards to safeguarding and any relevant training.
And you maybe could do something on a webinar for RCT just to get feedback that way. You get good numbers.
Yeah, I'm hoping to do something with Luke on the website.
Partnership. But I got a question. So when does your new role start?
The new role will be starting July the 2nd.
Yeah. For how long?
What, 6 o'clock at night, is that right?
No, it's not. We're not going to look at an emergency service. We're going to have a dedicated day.
Oh, I thought emergency service is essential.
I mean, if any members of the deaf community need to upload a video, then obviously, you know, the intention is to let them know that nobody is going to answer that until the designated day and time. Person that we will be recruiting would need to be fluent in sign language, and would also need to go through an enhanced DBS check.
This will help the agency massively. Massively help the agency.
Yeah.
Between the mobile phone and just people knocking the door.
Yes.
Because we're only BSL level 1. Somebody who's obviously fluent in BSL can help so much.
Yeah.
Exciting.
That's right.
Exciting.
Great, thank you, Trace. Yeah, we look forward to it. We really appreciate you organising it all. Thank you.